call the LaPorte County Board of Health meeting for July 30th, 2020 to order. Roll call, please, Julie.
Great. Dr. Uhas.
Present.
Mr. Sandy. Mr. Sandy. Mike.
Mike? Go ahead.
He can't hear us. He's here.
Okay, Mike's there. Keep going.
Mrs. Arnold.
Here.
Miss Swan.
Here.
Dr. Dora.
Here.
Dr. Manning Cox.
Here.
And Dr. Nelson. Okay. And I know Mr. Mollenauer is traveling, so he will not be joining in this evening.
Okay. All right. Very good. And I would like to also welcome Dr. Manning Cox to the board, and thank you for being here. And we'll get going with Dr. Cox. You're a little bit low on the screen. All we see is over your head. There you go. A little bit higher. A little bit higher. Almost. I don't know. I'm not one to talk. I didn't have my mic turned on, so I shouldn't really talk about it. All right. Next item on the agenda. Yes, thank you, Doctor. The next item on the agenda is the approval of the minutes from April 21st, 2020 meeting. So is there any questions or discussion about the minutes from our last meeting? If not, I'll entertain a motion to accept.
Also move.
I'll second that.
All in favor?
Aye.
Any dissent? No. Okay. The minutes are approved. Next item on the agenda is public comment. Kind of a formality, but since we're Zooming, but somebody could log on if they were interested, so they would be welcome. However, at this point, we're going to go ahead and have a call for public comment once, public comment twice, public comment 3 times. Hearing no public comment, we will move on. Now, the health officer, Dr. Ducey?
I'm here.
All right. I got you as the first person on our report, so would you kindly let us know what's going on?
I think the answer to that is nobody's really sure what's going on. Everything changes just about moment to moment in terms of the numbers. The United States numbers are now, we've had over 150,000 deaths, which is 0.05% of the population when you think about that. So, I mean, it's a significant number, and unfortunately it's only going to go up even farther. Hospital admissions are going up, and that's across the country, and that actually is in LaPorte County. Now, just a tick, but they're up a little bit too. We have in LaPorte, we've had just over 770 cases, and over 12,000 have been tested. And our positivity rate is 8.9 at this particular time. Now, that matches up with the positivity rate for the United States in terms of testing at this time. So we're kind of following right along. One of the numbers that has changed a little bit, the percentage of people with this now are younger. It is 18% in our state. 18% are between the 20 to 28 range, and then the next 16% for each from 30 to 49. So that's changed a little bit too. So CDC also changed the guidelines in terms of quarantining. Is that if you have a positive test, you only have to quarantine for 10 days instead of 14, as long as you are afebrile without the use of medications for 10 days. If you are contact, but you do not have the access to a test, but you assume that you may have it either because you're symptomatic or it's been a close contact, it's still the 14-day quarantine is recommended. And again, at the end of that, it still has to be 24 hours with no fever. So that's still coming up. What is probably the newest thing, just in the last couple days, the FDA has given some limited approval to the formation of home testing, and that lots of people are interested in it. The NIH is having a Shark Tank type of contest to see who they can get, and there's a lot of money that's being put into this to find a quick turnaround rapid tests. Problem with the ones at home right now is one of the studies that are done on, number one, none of them are FDA approved. They have exceptional use approval, but that's not the same. One of the tests that they were doing that they did have a chance to look at had a 50% rate of being accurate, which is not really exactly that great. 50%. And the other thing is that, again, they're still 3 to 4 days out. The whole concept of what they're trying to do, and that's what this NIH and all the people that are working very hard on this are trying to do, is have it the same idea as if you have a pregnancy test, is that you can, every morning before you go out the door, you can look and see whether you're positive or negative, and it can be repeated. Some of the ones that are actually being sold out on the market, a lot of the problem is they're very expensive. I mean, it's I saw anywhere from $100 to $200 for one test. So, I mean, obviously, that's prohibitive for a lot of people, although some say they will take insurance, but that doesn't seem to be a guarantee. So, you know, right now, the biggest problem that we're having, and everybody knows this, you don't need to be at a meeting like this, is the fact that we are just exploding again, particularly down in the south and the west. Indiana's kind of holding its own, as is LaPorte County compared to a lot around us, but the numbers are frightening. And of course, what's coming up right now that is making everybody wondering where we're going to go next is the school systems. And you probably have both heard, or have all heard, that both Michigan City and LaPorte are going back in different kinds of ways. Private school like Lalamere and Renaissance, they all have their own plans. So everybody has a plan how to get these kids back to school, and it's quite complicated. So that's also something that we will have to be watching as part of the health community to see what's happening in the schools when these kids actually are there. That's COVID, I think, unless anybody's got a specific question. The other thing that's been going on in our unit is that we have 2 people with TB that have been extremely uncooperative, one more than less, and it's been quite complicated. Nelson, you may know probably more about that with some of this stuff that's going on, and we are trying very hard to get them treated, and hopefully with some of the legal, I'm not sure threats are quite the right word, but the legal issues that have been very clearly explained to them, they are going to be more cooperative. So that's kind of thrown in along with all our concerns about COVID.
Wow. I heard today, maybe I misheard it, there's a American dying every minute from COVID?
I have not heard that.
I have not heard that either.
I have not heard that. I'm not going to say it's not true, but I did not.
For a couple of days, I don't think it's been going on for...
Oh, the number's going up every day. I mean, there is no, right now, if you look at any of the graphs that are out there for the United States, even for Indiana, all the other states, I mean, nobody's flattening. Nobody's flattening. You know, some are slowing a little bit on how they're going up, but we still are such a long way from being anywhere near where we should be. And, you know, again, I'm sure you've also heard is that Governor Holcomb is keeping us at 4.5 for another month in terms of the opening, and again, he's very on board with the whole concept of having masks, which is something that's obviously been very important to us in LaPorte County.
Yeah, the governor has done a great job, the health departments have done a great job, and I can really see a difference just speaking as a citizen and a member of the community. It takes the stress off of people because it's no longer, well, you wore a mask, I didn't wear a mask. You go out in the store, everybody's got a mask on, and it just like diffuses the situation. And I know there's a lot of issues with going to work and long-term wearing and how it presses on the face, but I'll tell you, if you're going to like a grocery store or CVS or Walgreens or anything like that, you're in and out of there maybe a half hour, 40 minutes. There's a lot of comfort in having everybody around you on board with the masks. And so I thought the governor and the county did a great job with that, so thank you. Is there any relationship with the TB and the COVID because they're both pulmonary? Or is it...
I'm sorry, I did not hear the question.
Is there any relationship between the COVID and the TB that's appear in our community.
No, just added stress. Just adds to the stress for
Just
everybody.
Add to the stress for the nurses, that's
Yeah,
all.
the nurses are just having a tough time with it.
Yeah.
It's very frustrating not being able to get someone to cooperate when they have active TB and are out in the community. And
They are wearing masks, right?
No.
He was out in the community. Now, he is, as of today, back in isolation, but for almost a month we couldn't find him. I think that's the right way to put it, right?
We had a court injunction. Nels could probably talk about it more. We had to take him to court. So
Could I ask this medical question? Does wearing a mask protect the wearer from TB? I know it doesn't necessarily for COVID, but if we're wearing a mask anyway for COVID, are we getting some protection in case we run into someone with TB?
Yes.
Really?
As far as I'm aware, yeah. Well, anything that helps protect, it from coming into you. But TB's not quite as, from my understanding, is that you do get some benefit from wearing a mask. I couldn't give you a 10%, a 50%. I don't know that for sure.
Well, with COVID, the issue and protection of the wearer was that they're so small in microns, and I don't know how big TB is, and I think that's what would play into whether or not masks protect. But, it's just a good thing to do at this point. Does anybody have any questions for Dr. Ducey?
I have a question.
Yeah.
So we have 110,000 people in this county, and I was looking at the most recent Indiana State results saying that LaPorte County has 787 positive people that have tested positive through all of this time.
Right.
And then I'm looking at the prison numbers, and like the Westville prison numbers, that there's like 109 staff that tested positive and 259 inmates that tested positive. So is that 787 that is LaPorte County? Does that also include the 311 people that are at Westville and the 30 people at the Michigan City State Prison?
yes, it does.
Okay. Allie, does it answer your question?
Yes, it does. Thank you.
Very good. Does anybody else have a question for Dr. Ducey? If not, do I hear a motion to accept the health officer's report?
I'll make that motion.
Anybody second?
Second.
All right, all in favor?
Aye.
Aye.
Anyone opposed? All right, it's accepted. Thank you, everyone. Next, we have the administrator, Mr. Mancuso's report.
Okay, good evening. I'm gonna start off with non-COVID stuff. I'll talk office stuff now. This past Tuesday, the budget hearings were. They had the budget hearings. They were asking all the departments to cut their budget 5%. We did not have to cut ours. In fact, I added another $20,000 for our contract people. And as I go on my report, you understand why I had to put that money into that contract. Basically, that contract line item is Dr. Ducey's salary, so all I did was just add more. So I'm taking the money out to pay these contract employees out of Dr. Ducey's salaries per account number, not your salary. I'm sorry.
Well, that was
Your
news to
account
me.
number, not your salary. Your salary, you're all covered, Doc. Don't worry about that. So we were able to. So the council approved it. So we were lucky they didn't cut none of our budget. So we're good for 2021. Moving on here, personnel. I know Danielle Glasgow. You see her name at the bottom there. She is our emergency preparedness person. She made all our staff do the FEMA training modular. So Danielle, you could talk about that later. Moving on, I had public. I'd like to thank Karen Springer. She was our public health nurse, one of our public health nurse who retired. Karen joined us back when we had H1N1 back in 2009. And then back in 2013, we brought her aboard full time. So she's resigned for retirement. Well, good for her.
Yeah.
Second, and then also August 14th, I have another nurse that's retiring. So I've already lost 2 nurses this year. So Carrie LaFountain, she's been here probably just as long. Probably 11 years too, so she's retiring.
She was an H1N1 nurse also.
Yeah, she was also an H1N1 nurse. So we took a lot of H1N1 nurses back in 2009, and they're all retiring now. But we were able to hire a new staff member. Her name is Mariah Keller. She's an RN. She's for practice at Franciscan Health in Porter Regional Hospital. So she joined us this week. So she's being trained now. So, we'll be hiring another nurse as soon as Carrie's gone. Any questions on the budget or employees or anything as I move on to COVID?
I want to say thank you to the retiring nurses and thank them for their service.
Yeah.
And I just want to interject. I see Dr. Nelson's here.
Oh, okay.
So Julie,
He did.
Dr. Nelson is.
Dr. Nelson is here.
Very good, thank you.
Dr. Nelson's here. Dr. Nelson's here.
I did not get my packet. I know last month I thought I had misplaced it, but I did not get a packet this month
Okay, well,
either.
all right, we'll have to, we mail them out. I don't know what else we can do. Maybe certified? I don't know.
I might have to go, sir.
We might have to be certified now because we know a few board members aren't getting their packages, so we'll look into that. We'll make sure, or we can email would be a little.
The mailing, it went to Dr. Nelson's home address, not the office.
Julie, what? We can't hear you.
The mailing for Dr. Nelson went to his home address, not his office.
Yeah, that's well, but still, I didn't get anything.
Okay.
So
All right. We'll correct that. We'll get that taken care of. Thank you for letting us know. All right.
All right. Yeah. Thanks for letting us know. Okay. Moving on to COVID-19. Last time we talked was April. A lot has happened. So first, July 6th, all the as you know, when we talked back in April that a lot of the offices were closed, but we were open because we were essential. So we didn't have staff up there all the time. I had my rotating schedule. July 6th, the county decided to open all public buildings, which is all public offices. And we were responsible for hiring screeners because what Dr. Cora wanted us to do is, as you entered the building, you had to have your temperature taken. So we were given the responsibility of hiring people. So I hired 7 screeners that worked the Michigan City Courthouse, the Hyler Building, and the courthouse here in our annex building. So they're sitting out there in a tent. As you walk in, they have to get their temperature taken before they enter, and they have to have a mask on. We provide masks for them too before they enter the building. There is an officer at each one of these buildings, just in case anybody gets a little irate. So Sheriff's Department has officers out there with us too. So as the building will open, as we move on, just a real quick figure. For me, and this is where I was talking about the contract, where I raised the rate on that. Obviously that's for next year, but this year I had to go to the council and ask them for an additional $15,000 so I can pay these screeners, and I had hired a couple other people. Then I had to go ahead and take money in my own budget and put more money in there, so I found another $10,000 into that account. As we move forward, each month goes by, that money does not last very long because the 7 screeners, we estimated in 1 month, it's $11,000 just to play those screeners out there. So, as COVID kept going and going, we had, some of you know Peggy Rose. Peggy Rose has been with us 20 years. She's our STD nurse practitioner. So she took on the responsibility of the nurse assistant living care. So she worked with the assisting care places, make sure they had PE equipment and anything else they needed. And then also we decided to go ahead and make her our public information officer. So she's going to be talking to the media. She's going to be going to places to talk publicly and all that. So there's another contract employee I didn't pay. So Peggy's aboard for that. Secondly, I hired another contract person, and her name is Erica Bunges. I probably butchered her name up, but she is also a nurse for 14 years. I offered a full-time job, but she only wanted part-time, so I lost her. What she does is she is looking over all the plans for festivals, the school plans, every plan there is to reopen. She's got the responsibility of reviewing all their plans. We don't approve them. She does not approve them. We're in the business. Our job is just to make sure they're following CDC guidelines. And that's what her responsibility is. So she doesn't approve the plan. She just makes recommendation that do this, do that, don't do that. Secondly, her responsibility, mind you, she's part-time, she's not full-time, is that the contact tracing out our county offices are open. If an employee with the county is positive for COVID, it's the commissioners wanted us to do some contact tracing to find out where that county employee was in the building so we don't spread it throughout the building. So her job also is to do contact tracing for county employees. Luckily, we've only had one so far in the building. So, moving on.
Please,
Go ahead.
Please convey our gratitude to the nurses and the staff that are out in the front lines, going out to nursing homes, prisons, working at the front door, taking temperatures. We are all grateful for their service.
I will. They need to know. Moving on with COVID. So basically, there's a testing site at the Civic Center, if you know about that. Daniel will probably talk a little bit about that. At the Civic Center, and basically, they're going to be done the end of August for the testing. So the state of Indiana put out a grant for us, for the health departments, and it's only $100,000. That's not going to get us very far. So I'm waiting for direction from the commissioners what they want us to do. How do you want the health department to run it? If that's the case there, then I'm going to have to hire more people, because right now I have nobody in our office to do that. We're stretched out thin enough. So I told the commissioners that if that's the case there, then I need to hire a director, and then we need to start hiring people to run this testing site, or we can take that $100,000 and collaborate with the hospital or another healthcare agency. So I'm waiting for an answer from the commissioners about what move forward on this. So as we keep going, in the state offered us another grant. This one's, well, let me back up a little bit. This is for IT, specifically computers, phones, any type of software. They were awarded from the federal government $14 million to all the counties, not all the counties, for the state, $14 million to the state. So they break down the size of your county is the amount of money that you get. So we would qualify for $221,000. So that's also to run the testing site if we decide to go that direction. Doesn't pay us for employees, it's just IT stuff. And what's happening, what I'm thinking is going to happen there is I think what they're doing with that money is I think they want us to take over contact tracing. I believe the state's getting away from all this. They're going to leave it all up to the local health departments. So I told the council, Randy Novak, and commissioners that basically if we're going to have this testing site, that the county's going to have to front some money. I don't have it in the budget. The good thing about this is everything that we spent on COVID is there's a CARES Act that we get reimbursed. So everything that we buy for COVID has to be submitted differently to the auditor's office so they can get reimbursed somehow from the state on this in the CARES Act. So that is all I got. Any questions on all this? I don't. There's a lot going on.
Let us know what the commissioners say. Does anybody have any questions for Mr. Van Kinsel? If not, we can accept the administrator's report if somebody makes a motion. Do I hear a motion to accept the report?
So moved.
I'll second that motion.
All right. All in favor?
Aye.
Anyone opposed? Nope. It's approved. Next, Environmental Health Supervisor, Amanda.
Good afternoon.
Good afternoon.
I'm happy to report that nobody is retiring from environmental and foods. We are still all there and all on staff. Everything is really kind of run together these last couple of months, not knowing. Well, I think we know what day it is now because we're back in the office 5 days a week. But there for quite a while, we didn't know we were coming or going, or what day it was, or where we were supposed to be. And I don't think anybody showed up on a Saturday or Sunday, but I wouldn't be surprised. So I am full staffed right now, and I have 2 interns. We have 2 interns this summer. Sarah came back from last year, and then we have a new intern, Marissa Sullivan, who joined us the 1st of June this year, and both have been helping out so much with just our regular workload, but also with COVID. I think they've got more than what they bargained for this year, but they didn't run for the hills screaming. So, starting with stage 1, as you know, shut down all the restaurants back in March. We were closed, the restaurants were all closed down in April, except for drive-through and carry-out only. During that time, we were not doing any food inspections. We were in the office, though, doing consultations. We were constantly on the phones and chasing down complaints throughout the county about restaurants and bars. When stage 2 came around May 4th, that was when restaurants, the dining rooms could reopen. The dining rooms at that time could reopen at 50% capacity. Bars were still closed. Before that time, at that time, we got out in the mail hard copies of what the governor's reopening plan was going to be for restaurants, and also what our plans were going to be for inspections, letting everybody know we don't know 100% what the plans are going to be, but when we come out and start doing inspections, this is what you can expect from the health department. We also at that time decided to hold off on starting inspections right back up, just because everybody had already been closed down for a good 6-7 weeks at this time. To walk in the very first day of being reopened was just going to put people over the edge. So we wanted to give them a time to get back into routine and to be able to get their establishments back up and running and cleaned and making sure, stuff's been turned off for a month, to go plug the refrigerator in, and the refrigerator decided didn't want to come back on. So we didn't want to add to that stress. And we let everybody know up front that we were not going to be there for the first couple of weeks. Still out doing complaint investigations, though, and those daily consultations with people on the phone. And we do have almost 700 permitted food establishments within the county. So everybody was trying to figure out what was going on, what they could do, what they couldn't do, and what we could do to help them mitigate the situation and get back into operating. We also decided once we started inspections again that we weren't going to put anybody on probation, because again, we didn't want to add to that. We didn't want to add, when they go on probation, there's a financial fee associated with that. So we didn't want to add to that burden also. But we did increase the inspections and doing that education and saying, okay, what else can we do to help you to get to the point where we're not having these issues? May 24th started stage 3. There really wasn't any change in foods or environmental services. The only thing really was that tattoo parlors, which we permit, were able to reopen by appointment only. June 14th was the start of stage 4, which everybody was doing a happy dance because the bars could finally reopen. The bars were reopened at 50%, restaurants 75% of their normal capacity. They still had to do social distancing. So whichever was the lesser. You could be open at 75%, but only if you could still have that social distancing of the tables 6 feet apart and so on and so forth. And then the casinos were also able to reopen, and Tony and I went to Blue Chip a few days before that. I think it was on the 10th of June, and we toured their facility to see how they had the casino floor set up and also their restaurants.
Are they maintaining 6-foot distancing at the casino?
They are.
Yeah, they are.
They rearranged the gaming,
Machines?
the
The machines?
the machine. Well, they didn't move the machines around,
Oh, the chairs.
so if they couldn't get the machines weren't 6 feet apart. They blocked off the one machine so it couldn't be used.
Right.
It was the table games. I don't do table games.
The table games, yeah, they're limited to 3 people at a
They're
table.
limited to 3 people per table, so those were all
Are
stretched
people
out.
mandated to wear masks?
They have to have a mask coming onto the boat.
Yeah.
Temperature check too.
And their temperature is also checked before going onto the boat.
Do they keep them on while
They're supposed to keep them on while they're
Okay.
playing, but you also have to remember that is a smoking facility, and it's kind of hard to smoke with this mask
It's
on.
not no more. They changed.
Currently, it is not smoking.
Yeah, they
Oh.
changed.
They changed it a few days ago. You
Yeah.
have to wear your mask all the time
All
while
the
you're
time.
there.
Okay.
Right.
Unless you're having a beverage
Yeah.
in the bar area, and there's no smoking on the boat at all.
Right.
Good to know.
When we first went to inspected it, they were saying that only if you were at the slot machine you could smoke and not at the tables. But yeah, I heard that they changed that, so now it's non-smoking.
Okay. All right. I was wondering about that.
And then, of course, stage 4.5 happened, which really is an extension of stage 4. It just kind of put the brakes on everything and slowed it down. When we were supposed to get to stage 5 on July 4th, everything was supposed to be back open at 100%. And the lifting of all these other restrictions, and as we know, that didn't happen. So now we're at stage 4.5, which is still, like I said, is an extension of stage 4. So restaurants are at that 75% capacity, and bars are at 50%. Everybody does inside a restaurant who is employed and working there has to have some kind of face covering on at all times. So whether you're on the line or a hostess, they have to have that mask on. There's been a lot of confusion about that.
Okay.
And we
And I
haven't, I'm sorry.
Patrons wear the masks to the restaurants too.
They're right. You have to, you have to. There's no mask police out there. But you're supposed to have your mask on when you're, basically anytime that you're not sitting at your table actively eating or drinking. So entering and exiting the facility, using the restroom, they're supposed to have a mask on.
I must say that I have a local restaurant that I monitor as my reference, and since the mandate went in, people are going into the restaurant with masks on.
That's
Prior to
good.
that, they had not been. Once the restaurant opened up at 75 or 70%, people were just going in, and there was no social distancing. Parking lot, at the front door. I didn't go inside, but no one had masks. I'm happy to report, for safety's sake, that they are wearing masks now, going in and coming out.
That's good.
Yeah.
You kind of see it in waves all over the place. It's like a couple of different places and everybody has a mask on, and then the next place nobody has anything on. So that's always frustrating and a little mind-boggling. But anyway,
I think a lot
digress.
depends on the store management, where,
Yeah.
like I said before, if you go to Menards, they make you wear a mask to go in. Now Lowe's is doing it. So many stores are. CVS is. So again, it's the policy that's set as you walk in the door. That's what it seems to, if it's non-negotiable and people are asked to wear it because it's private property, they wear it.
And as you know, all the festivals have been canceled. The fair was canceled due to COVID, so we haven't had any temporary inspections. The water lab remained open during this entire time. We are the only public drinking water lab in the county. We felt we needed to keep that open. IDEM was not loosening any of their requirements for water testing, so we felt we really needed to keep our lab open. That was one of the reasons we felt like we needed to keep that open. septic systems did not slow down at all second quarter. We were actually busier this year than we were last year, even with COVID. And being in the office only 3 days a week, because compared to 5 days a week, we were rotating, so there was always somebody here to cover. And while the building itself wasn't open to the public, meaning they couldn't come up to our floor, they were down in the lobby. So we would come downstairs and meet people in the lobbies to get them their well permits, septic permits, their birth death certificates, to collect water samples, and to bring them down more paperwork and bottles if they needed it. And even well permits, we were 20 more well permits this year as opposed to last year. So the nice normal stuff is beaches. We started beach sampling again. This year we had a contract, of course, with IDEM, and we were contracted with IDEM to start sampling on May 18th, Lake Michigan, which we did. And inland lakes we held off a little while because the beaches themselves, the governor had closed all the beaches, recreational waters, until that first weekend in June, and that's when we started doing the sampling on those lakes. We didn't want to sample the inland lakes and post that they were good to swim in when people really weren't supposed to be out doing that. So that's why we held off on that. Inland beaches, we've had quite a few advisories this year, and it seems like they're a little bit higher for this time of year. Like typically for Upper Fish Lake, we'll only have like 6 or 7 advisories for the year, and we have a whole month of sampling ahead of us still, and we're already at 6 advisories for Upper Fish Lake. Liberty Beach also, last year we only had 1 advisory, and this year we're at 4 for the year. So it's kind of interesting to see how those. I don't quite know what to point that to why those numbers are higher at those inland lakes right now, but yes. So, does anybody have any questions for me?
Of course I do.
Of course you do, Dr. Uhas. I was going to be disappointed if you didn't.
Well, I love coming and learning from you. Public service. All right, our next meeting is in October, which is what triggered this question. When we come back, that's about the time that healthcare experts on TV, of course, have predicted that there might be a bad thing happening called a second wave, where we have a confluence of the flu season and COVID is still going on. And it's supposed to be a bad thing. So I guess my question is, are we going to be still giving just the regular flu vaccine? So when we come back in October, we should be thinking, hey, we should be at least getting our flu vaccine. And of course, for seniors, you guys don't do the senior vax, but we go to CVS, they offer it, other places do. Is that still going to be taking place with the flu vaccine and the recommendation that seniors get their little vaccine too?
Yeah, I'm
Yes.
sure.
Yes.
Yeah, our clinics are open now, right now, and I don't. As we move to Jenny's report, basically, we opened the clinic, so they started doing the shots again and blood profile. Now, unfortunately, I did not open the Michigan City office because I'm short a nurse there. So yeah, we'll continue to keep doing the clinics, but I don't know what will happen in October if that gets that bad.
But the recommendation will be to go ahead and get that vaccine at least.
Oh, sure.
Absolutely.
Okay, yeah. That's a good thing for the public to know. I've always thought it was a good thing.
Right.
Thank you for doing that too. Yeah, are there any questions for Amanda on her report? Anyone? If not, is there a motion to accept the health supervisor's report?
Motion to accept.
Is there a second?
I'll second.
All in favor?
Aye.
Any opposed? Nope. The ayes have it. Next, emergency preparedness. And then, Tony, I'll go to whoever's going to discuss Jennifer Smith, RN's report.
Okay.
I could introduce it, but let's go ahead with, is there emergency preparedness coordinator?
That's Danielle.
Hi. Can I turn on my camera?
Yep.
Hi, Danielle.
It's been a crazy whirlwind, as y'all know. Came on board, and then we had the world's largest pandemic, so this has been fun and a big learning curve. We're doing a lot right now. As Tony said, we moved the testing site around and trying to get it situated with the state, and make sure they have all their supplies. We're working on getting the plans, emergency preparedness plans updated, which is a large struggle due to the fact that everything changes every single day. So, we're playing fiddle with that. So, supply-wise, I think we're sitting okay. We've worked closely with Peggy Rose as well, working with the long-term care facilities to make sure they have everything they need as well. We've only had a handful of requests the last month or so, so that's kind of slowed down. I think everybody's getting more prepared. I think that's about it for now. Is there anything else, Tony, you want me to talk about?
Can you talk about the training everybody, all the staff members had to do?
Yes, I don't think they really liked me at that moment. All the staff at the health department pretty much have completed all their courses as I've asked for FEMA. That way we're all prepared and ready to go in the event that we had a mass clinic that we needed to put on or make handle with, medication or vaccine. So they've all completed those. I myself have to go through a very rigorous training courses, so I'm working on those every week still, and as I said, things change all the time, so they add new stuff for us frequently. So it's been a lot to keep up with, just being part-time.
Thank you for your service. Does anybody have any questions? If not, do I hear a motion to accept the Emergency Preparedness Coordinator's report? I need a motion and I need a second.
I'll make a motion to accept.
Is there a second?
A second.
All in favor?
Aye.
Aye.
Anyone opposed? All right, the report is accepted. Next, we have the attorney's report. No, Mr. Pichardo, are you there?
Yes, can you hear me?
Yeah.
Hello, everyone. Just wanted to give you a quick update because I know there was some discussion regarding the TV situation. Our office was able to file a complaint and injunction, and we were able to successfully get a order from the judge ordering these individuals to comply. So, as far as I'm aware, they have been following up and in compliance since we were able to obtain that court order. So wanted to give a quick update on that. The other situation that we've been dealing with routinely for a long time now is, as Ms. Lanish can let you know, we've been in this Twin Acres litigation, and we are continuing to handle that, and we recently had some depositions, and we will continue working through the discovery on that case. Other than that, there is nothing to report.
Very good. Do we have any questions for Attorney Picardo? If not, do I hear a motion to accept the report?
So moved.
Second?
I'll
Anyone?
second.
All in favor?
Aye.
Anyone opposed? Ayes have it. Thank you. All right, old business. Do we have any old business on the agenda that we need to discuss?
Nope, we don't.
I didn't think so.
Not till COVID's over.
I told, yeah. Is there any new business other than COVID?
No, we've just all COVID, just, trying to get grants and funds and all that. That's basically what we're trying to do and set up a testing site.
Okay, well, keep us posted. And before I forget, I want to thank Jennifer Smith for all her hard work. I've read her report. She has taken some well-deserved days off, and we wish her a good rest and health. Everybody should have that, except for Dr. Nelson. Everyone should have that in their packet. And I know Julie will send you the packet for this meeting.
Absolutely.
Do you have any questions for Jenny's? I mean, I could probably try to answer them for you. I know, Jennifer, it's the nurses, when this COVID started, we have to remember now, when the offices were closed, we suspended the clinics. So I had all the nurses doing the contact tracing, if you recollect that. So then when we opened the offices, that's when we had to open the clinics. So good thing that the state took over the contact tracing away from our nurses. But now we still have a lot of things that the nurses are doing. I mean, Jenny, she's on vacation now, but Jenny was still giving the counts to the commissioners and everybody how many positive cases we've had in LaPorte County. So she did that. Now Carrie's doing that. So they're splitting that duty. Then Jenny was responsible for the schools, the opening of the schools, and so was I. So that's why I brought Erica aboard, so she can take that over away from us so we can do our normal working jobs. So one of the things that happened is that people realize that the nurses, they really can't do COVID unless, they have clinics too. So we have to decide between clinics or COVID. I mean, what do we, I was telling the commissioners, what do you want the nurses to do? I mean, they can't do both. There's just no way. So that's where I said we need to start hiring some contract people and get more nurses in here to help us out. So that's where we're at right now.
Well, you can tell by her minutes that they have been really working hard around the clock, 7 days a week. So we are really grateful for that. And are there any comments about the nursing supervisor report that we have in our packet? If not, we can have someone make a motion to accept it as it is in our packet. Are there any questions? I want to make sure I didn't miss anyone. If not, can someone make a motion to accept the nursing supervisor report? Anyone? Thank you, Doctor. Is there a second?
Second.
All in favor?
Aye.
Aye.
Anyone opposed? All right, the ayes have it. Which brings us to the next item and the last item. The next meeting will be in October. We usually do this on a Tuesday. This was kind of a favor to do it for a number of reasons, to do it late in the month. But we could go back to Tuesdays. I'm going to throw out a date, Tuesday, October 20th at 4 p.m. How does that look for folks? Any conflicts of schedule?
Not at this moment.
I'm aware of now.
Okay, is there anyone that can't make it? Dr. Nelson? Sir?
I'm looking at my call schedule. That would be the only thing. I am on call that day, but I'm usually done by 4. So,
Okay.
and I can do a Zoom meeting from the hospital even if I'm there, so that's no problem.
All right, perfect. It's always great when we're all here because, everybody needs to hear and has their input if they need it. Okay, then does anybody make a motion that we do it October 20th, Tuesday at 4 p.m.?
So moved.
All right, all in favor?
Yeah.
Yeah.
All right, the ayes, anyone opposed? The last chance. All right, the ayes have it. And with that, do I hear a motion to adjourn?
So moved.
Second, anyone?
Second.
All in favor?
Aye.
Aye.
Consider the gavel slapped. We're adjourned.
All right.
Thanks, everyone.
Anybody
Safe, everybody.
could join us over here. We have to pretty much scattered out. We got a lot of space up here for everybody.
I'm glad you. Yeah, that's great.
I got up there. We thought you guys sit up there. A couple of you down here.
Well,
I just want to get out of the house.
Before we all leave, I just want to confirm we're still doing it Zoom.
Yeah. Oh, yeah. Until you're different. Yeah.
All right. We're all good with that, right? Yes. Yeah.
Yeah.
All right.
All right. Thank you all.
Thank you.
Thank